But very important to know that it may take about 2 weeks to one whole month for it to start to work. And so some of the patients I've talked to, they'll get the flu vaccine when their coworker they've been eating with the whole week has already tested positive for the flu. And they think that they'll get that protection right away, but they're wrong. It actually takes at least 2 weeks for that protection from the flu virus to protect them.
Mhm. Thank you for joining us for another episode of Spotlight Houston, where we bring you the best of the people, places, and events in Houston. This week, we're revisiting the world of colds and flus with a replay of our talk with Dr. Christine Lee of Kelsey-Seybold about how we stay healthy. This is episode 70 with an original air date of Sunday, January 14, 2024. And now your host, Blanca Quezada.
Hi, and welcome everyone to Spotlight Houston. So today I wanted to figure out for all of us, not just for myself, how to tell the difference between a cold and a flu because I always get confused. And so even my family and my friends, when I ask them, if they're sneezing or their nose are dripping or whatever is dripping, I always ask them, "Well, do you have the flu or do you have the cold?" And they're like, "Well, I don't know. I guess I got the cold." So I think that we need to settle this once and for all. So I've invited Dr. Christine Lee. She's a family physician at Kelsey-Seybold Clinic. And so, okay, winter is back. We're starting to suffer from, like I said, either the cold or the flu, as well as, of course, other different respiratory issues. So I don't know if you're like me, but it's hard to be sick. So I want to make it clear and I want to understand what exactly we've got. So I've invited Dr. Christine Lee, OD. She's from the Kelsey-Seybold Clinic. Welcome, Dr. Lee.
Hi, Blanca. Thank you so much for inviting me.
Well, it's great to have you here, especially because I'm always constantly during the winter getting a cold or the flu, but I don't know which is which. So, so I want to clear up this debate about what it is we're suffering from. So, how can we know whether we have a cold or the flu? What are the symptoms? What should we look for?
Well, the cold and the flu, it's sometimes a little confusing initially because they both may be very similar. I call it, is it
Yeah.
a horse is it a zebra or is it a horse with black and white stripes?
Yeah.
So initially for the first day or so, most people may still feel a little bit of body aches, maybe runny nose, sore throat, cough. The flu is very potent. Many patients will complain about extremely high fevers. And usually we see temperatures that are much higher than the usual low grade temperature fever of 100.4. Most of the flus that we see tend to be much higher 101, 102, 103, 104. And most patients will complain about extreme body aches. They'll tell me that they feel that they got run over by a car. Their head is pounding. It's just, think of it like a regular cold multiplied many times. And so most of the time, people can tell if they've had a flu. They get the fevers, they get the chills, they get sweaty. It's a terrible feeling. And most of the time, as it progresses from the initial day or two to the temperatures and the body aches, most people can tell that they probably have a flu instead of the common cold.
Okay. Well, that kind of clears things up for me. And I'm sure for a lot of our listeners as well. Okay, if we got a flu, we have fever.
Most of the time,
Basically,
yes, yes.
yes. Okay. So why is it that this happens more during the winter than any other season?
That's a great question. So, colds and viruses and flus, I do need to let everyone know that actually they're around the entire year. However, certain months of the year, they seem to be more active. And oftentimes, for example, with flus, it may depend on bird migration
Mm,
and also certain months. And so oftentimes it may start in the early autumn, maybe September, and then it goes all the way through early springtime, February or March. And in some cases, I think there was one flu season where people kept on getting sick until May or June. And
Oh,
so
wow.
each year can be a little bit different. But oftentimes, when the season is colder, people tend to stay indoors.
Hmm.
And so they're crowded together. And the interesting thing with colds and viruses, did you know that people are most contagious about 1 to 3 days prior to getting sick? And so that's a big problem there. People like to talk to each other and spend time indoors. And then you have the seasons changing where the germs are a little bit stronger. And in some instances, we have found that the immune system might act differently when the weather's colder. And so there's been some data to suggest that the nose may not be as strong against fighting germs when the weather's a little bit colder. And I think sometimes, when the weather changes, people get a runny nose or they'll rub their eye. And if they touch a surface that someone else has touched, then, or if someone sneezes on them and they're very close to them, then they could actually get sick. And so that's probably why we see more sick people during the winter months.
Yeah, you just surprised me by mentioning birds. I would have never imagined that due to bird migrations, there was a possibility that we could get sick.
It's very interesting. And sometimes how we can determine when the flu season might start is sometimes they find out where the flu season is in other parts of the world. And so it seems that they will look at a country like Australia. And then if they find that flu season is starting up a certain month, they predict that in a few months it might come towards us. And so it's very interesting when we think about all of that.
Yeah, I keep hearing right now that across the country, right now, here in the United States, there's been a rise in respiratory problems, colds and flus included.
We've definitely been seeing, I call it the ice cream sundae of germs. And for a lot of the patients I've talked to, they think that if they get one germ, then they can't get the other. And unfortunately, we found that people can collect more than one at once. And it's still flu season now. Really, outside of basic hygiene and washing hands, the best way to prevent the flu is to get vaccinated against it.
Hmm. How does that work? How does a vaccine actually work?
So, if we're talking about the flu vaccine is it's inactivated, which means that it's not live. And the nice thing to know is that they put four, it's called quadrivalent. And so they figure out what kind of strains are coming at that season. And they make a vaccine that fit, it's like a lock and key. It's their best bet about the four flu germs that are going to come that season, and it's safe to accept. It can be given at the doctor's office or the pharmacy, and it's safe for anyone 6 months and above. But very important to know that it may take about 2 weeks to one whole month for it to start to work. And so some of the patients I've talked to, they'll get the flu vaccine when their coworker they've been eating with the whole week has already tested positive for the flu. And they think that they'll get that protection right away, but they're wrong. It actually takes at least 2 weeks for that protection from the flu virus to protect them.
Hmm. Well, Dr. Lee, why are a lot of people afraid to get the vaccine? What are some of the misconceptions or myths about getting this particular vaccine?
And so, as I was talking about, I think that people tend to wait a little bit longer to get the flu vaccine. And so, once again, the flu vaccine takes about 2 weeks for it to start working. And that's going to be in children and younger adults. For people who are 65 and up, or maybe their immune system is different, they have diabetes, they have cancer, it may take 30 days for the
Hmm.
flu to offer any protection. And because there's usually four strains of the flu, so even if someone got sick a month ago with flu A, they can still collect the other strains if they're not vaccinated. And so we highly recommend to accept the vaccine. People have the power to protect themselves and others with the flu vaccine, and it's very safe.
Yeah, but it's not 100% because we still can get sick, as you mentioned.
Yes, you are right. It's almost like a lock and key. We try to predict the flu strains that are coming, and it can sometimes be anywhere from 40 to 90% effective and accurate to the flu strains that are that season. But it's very helpful because what we're looking at is if you can accept something that will prevent the flu or prevent suffering, then there's less risk of having to go to the hospital, and that's always better for everybody.
Hmm. Can having a cold or flu also cause pneumonia?
Oh, that's a very good question. And so flus and colds are what we call viruses. And I sort of tell people it's almost like having your car broken into and your doors open. Other germs can actually attack. And so the immune system has been compromised, a virus has attacked, and it can sometimes take anywhere from 2 weeks to a month for that immune system to get better. And what we sometimes see is in some cases, half the people who got a cold or a virus may sometimes wind up with a bacterial infection, which is sometimes different. And so they can sometimes get ear infections and sinus infections. And if they get exposed to someone who has a bacterial lung infection, who coughs and sneezes on them, unfortunately, their lungs might accept that germ, and then they can develop something very serious, a bacterial lung infection, a pneumonia, on top of a previous cough, cold, or flu that was more recent.
And with pneumonia, it's kind of dangerous because you could die from it if you don't get it taken care of.
Pneumonias can be viruses or bacteria, but the most dangerous ones tend to be bacterial. But on a good note, we actually do have vaccines that can prevent lung infections and bacterial pneumonias. And adults can get that if anyone has health problems that may include diabetes. There is a vaccine, it's called the Pneumovax 20 that's given to adults, and it's very safe. And it's been around, this particular one has been around for a few years, and it definitely helps to prevent bacterial lung infections for the people who qualify.
Mhm. What's the difference between bronchial pneumonia and just pneumonia?
Bronchial is a way of describing an area of the lungs. And so when we think about the lungs, we think of it like an upside down tree. And so, with the lungs, if you think of it as an upside down tree, on the very top, you have the tree trunk, and that's
Right.
what we call the main bronchus. And then it has branches, and then it has little leaves that we call bronchioli. And so, I think that it may be interchangeable, but it also depends on where the location of the infection is. Sometimes, if a person goes to the doctor's office or the hospital, and sometimes if they take a picture, sometimes they can see a location. Sometimes it can be on the right side, or sometimes it can be on the left side, or sometimes in some very serious situations, it can be on both sides. And that means that person is probably going to suffer a lot longer with the lung infection than others.
And could possibly be hospitalized?
Double lung infections are very serious, and that can affect babies. It can affect any adult who has compromised health, diabetes, asthma, smokers, people who have weak kidneys, weak lungs, and also patients above age 65. Their immune system just works a little bit differently. And
Mhm.
so it's good to know that we do actually have a vaccine called the pneumonia vaccine, which has been around many years. But luckily, in the last few years, they had the most up to date vaccine, and it's called the Pneumovax 20. I tell my patients that the 20 keeps the lungs younger, and that can be requested at the doctor's office. And also, many of the patients can also request at their favorite pharmacy team. That can be accepted there also.
Oh, great to know. Another question, is COVID still around and is it as potent as it was before?
It's a question that many of my patients will still ask me. COVID, unfortunately, is still around. We were really hoping, everyone was hoping that it would go away. And a lot of times now, we don't know how many people have COVID because they're doing the home tests, which I tell my patients are very accurate, but it probably should not be done within the first hour of getting sick. We found that at least 2 days after getting sick, it might be better to check. And if a person was feeling worse, they can check with the home test 2 days later. We're finding a lot of communities in the US are checking wastewater to have an idea if COVID is rising. And on a good note, we still have a very helpful COVID vaccine, which is available for anyone age 6 and up. And it can be requested at the doctor's office or the pharmacy. And it is very effective against preventing COVID and also decreasing the risk of super bad COVID. But yes, it's still around. But on a good note, I think it's not as deadly as it originally was a few years ago.
Hmm. And does this still affect children?
Yes. But once again, we find that COVID, it seems to affect certain groups a little bit more. And what we're looking at is the patients, the people who are most affected tend to be above age 65. That has to do with their age and their immune system. And then outside of that group, age 50 and above with health problems can be affected. And then younger folks who may have things like diabetes and asthma or who smoke, they can be affected more. And it does affect children, but it seems that the adults tend to be more affected than the younger folks.
So, do you still recommend that we get the COVID vaccine as well?
How I think about vaccines is I think that they're very safe. And I really think that people have the option and the power to protect themselves, to protect those around them. Because when you get vaccinated, you prevent your family members from getting sick. And you also prevent your colleagues and your coworkers from getting sick also. And what I tell my patients is it's like virus protection for your laptop or your phone.
Mhm.
Trust in the science. At this time, they're just looking at whenever the latest one is available. And so patients are asking me, is it too late to get a flu shot? And I was seeing a lot of patients today, and I said, thank you so much for requesting the flu shot. We have it available for you. Let me go ahead and offer that. A lot of patients are still asking, is it okay to get the flu shot and the COVID shot together? Yes, you can actually accept both of them. And some of my patients today were asking, I got the original COVID vaccine. Would it be helpful for me to get the more recent one? It's a great question to ask. And absolutely, the virus protection that was accepted years ago doesn't work against the latest COVID strains. And so there was a newer vaccine that came out in September. And so for my patients who had gotten it in May, I have to tell them, I think it's time because you got an older version of it. Go ahead when you have time, go ahead and request it from the doctor's office or the pharmacy and get the best and most recent protection against COVID.
So, how often should we get a COVID vaccine?
I
Is it
think the best way to look at the COVID vaccine and the flu vaccines is I think they're going to be different than, for example, a tetanus vaccine. A tetanus vaccine, we know that doesn't change much. It's good for 10 years. And the interesting thing with flu and COVID is it seems that the germs are very sneaky. They seem to change a lot. And so the previous vaccines don't work as well. And the interesting thing with COVID is they have these things called spike proteins, which I tell my patients it's like wearing different hats. And so the original vaccine was protecting against the pink hat, but now it's changed and now it's the green hat that we need to let our bodies be aware. And so I still think it's very important. We're not having enough people vaccinate against COVID and flu. With the flu, we're having maybe 4 people out of 10 accepting the vaccines for the flu. And for COVID, it sounds like only 19 out of 100 people have accepted the newest vaccine. And so we're still trying to educate them that it's very safe to accept. And it's just the best way to prevent COVID and also complications related to COVID too.
Hmm. I like what you said earlier about it's not just protecting yourself, but protecting those around us, our family and our friends.
Yes,
Um,
and remember with the vaccines though, we have to think about the babies. And so with flu shots and COVID vaccines, we can't give them to newborns. And so newborn babies, their immune system is well, they're just beginning. And so their
yeah.
immune systems haven't started yet. It's very weak. And so the best way to protect babies and also other people, for example, patients with cancer, then it would be to accept whatever is recommended for that person. That really
Hmm.
protects others.
Hmm. What is RSV?
RSV is a virus. It's called the respiratory syncytial virus. And a lot of people don't know what it is. And
Oh,
it's a virus that's been around a long time. The RSV is a virus that really gets kids and babies very sick. It is the number one reason that babies and young children have to go to the hospital. It's terrible. It causes them to have decreased appetite. They don't want to drink. They don't want to drink their milk. It can cause difficulty breathing. And it's very tough because it can last for a few days and even a few weeks. And so it's very tough for them, but there is hope because we have a new vaccine that has come out more recently, and it's the RSV vaccine. Now, there is a shortage of the RSV vaccine. We're only giving it to the groups that benefit the most. And so it is available to patients who are 60 and above. And also, if an adult has a health problem, they're considered immunocompromised, they have cancer, they have heart problems, lung problems, kidney problems, they can request it from their doctor's office or their pharmacy. And then they also, interestingly, they have it for pregnant women. And so
oh,
pregnant
wow.
women can accept the vaccine, but there was such a shortage of it. The pregnant women have to accept the vaccine to help their babies only from weeks 32 to 36 weeks of pregnancy. And so that's very helpful. And then there's a very limited supply of something called an RSV antibody that can be given to babies less than 8 months old that can try to prevent them from getting sick. And for those babies who have lung problems, cystic fibrosis, they were born very early, sometimes they would get another one of those RSV antibodies the following year to prevent
Oh,
them from getting sick. And it's so exciting because RSV hospitalizes 60,000 to 160,000 Americans each year. And it also causes 6,000 deaths. And so now with the RSV vaccine, although in limited supply, we're able to protect the most vulnerable. And it's about educating people because people think it's a cold virus. And I guess the best way to explain it is a virus, but it's a virus that has a vaccine. And so with the vaccine, we can try to prevent people from getting sick and
hmm,
also prevent them from going to the hospital.
hmm. Would supplements like vitamin C or zinc or something like that, it can help prevent some of these colds or flus or other respiratory issues?
I wish there was a magic wand or a magic supplement
Yeah, me
because
too.
that would be great. I think my patients would like it. I would like it too. I think for most folks, making sure that you go to the doctor's office, make sure you get your wellness exams, any necessary vaccines, making sure you know your numbers, make sure that you know what your blood pressure is, making sure that you know what your sugars are, your lipids, just having an overall idea of how good your health is very helpful. And also eating well is very helpful to keep your immune system strong, hydrating, and also beauty rest. We find that 6 to 8 hours of sleep a night is very helpful to prevent illnesses. But I have to admit, I wish there was some type of supplement or berry that would prevent germs. I don't think it's harmful. So I do want to reassure everyone that it's a okay. A lot of my patients tell me if they get sick, they feel like having some chicken noodle soup is helpful. If they want to take vitamin C supplements, I
Or
still think
ginger tea or ginger teas or green
yes,
teas.
yes. And so I think as long as it's natural, it's fine. And a lot of those things are considered food. And so there's no monitoring in terms of that. I know that people like to take the supplements, but sometimes the supplements are even more expensive than the actual thing.
Yes. Yeah.
I have a lot of my patients asking me about turmeric capsules, and I
Oh,
thought,
yes.
well, why don't you just buy the turmeric from the supermarket and put it in your food? I think that might be a little bit easier.
Yeah, for sure, for sure. So, how many times during the winter should we go and visit the doctor?
So, oh, that's a very good question, also. So, for example, I've been a family medicine physician for 20 years, and with my clinic at Kelsey-Seybold, our patients can message us if they have questions. And so, earlier this week, one of my patients who I've known for 15 years, she emails me and she says, "I think I got something. I'm not sure what it is. I'm having a little bit of a runny nose, and my head hurts a little bit, but I don't have a fever. Do I need to come see you?" And so I sent her a message back and I asked, "Are you developing a fever? Do you know what that is?" I also tell my patients if they don't know, there's something called a pulse oximeter, and patients still don't know what it is, but it's very helpful. It's found in where you can buy a thermometer at the grocery store or the pharmacy, or you can buy them online. And then when you put your finger through it, it lets you know some information. It lets you know what your oxygen level is and also what your heart rate is. And sometimes this is good to know because if the oxygen level, if this is accurate and the oxygen level is less than 90%, and a person's coughing, having difficulty breathing, if they have asthma, it's going to be more serious. If they check this and their oxygen level is 100%, and what she told me was her oxygen was 100%, she was eating very well. She didn't have any nausea, vomiting, diarrhea, abdominal pain, no muscle aches. She said she was starting to feel better every day. And so I asked her if she wanted to come in. She said, "No, I just need some reassurance." She
Mhm.
just didn't know when she needed to come in.
So, if our listeners want to get in touch with you or they want more information about some of these respiratory issues, how can they get in touch?
So I'm one of the family medicine physicians at a clinic in Houston called Kelsey-Seybold. And the best way to reach out to us is number one, if you're due for a wellness exams are usually recommended at least once per year. And so we are seeing a lot of our patients who are taking charge of their health. I tell them it's much like doing an oil change for your car or your inspection sticker. It's probably good at least once per year to book a wellness exam. And so you can talk with the physician or provider. It's dedicated time just for you to figure out what tests would be most helpful for you, knowing your numbers, knowing what your blood pressure is, knowing some blood testing depending on what your age is. It might be recommended to know your sugars or your
Mhm,
cholesterol, trying to
mhm.
figure out what vaccines could be very helpful. The website for Kelsey-Seybold is www.kelsey, Kelsey-Seybold, Seybold.com. And the best way to get in touch with me is actually to book a physical or book an appointment with me.
Okay. Okay. And of course, the Kelsey-Seybold, their phone number is really easy, right, to remember?
Yes, there's a main phone number line. The Kelsey-Seybold is 713-442-0000. And there's someone who answers the phone 24/7. Patients can book their appointments online or actually call that number 713-442-0000 any time of day, and a person will pick up and help them to book an appointment.
Well, thank you, Dr. Christine Lee, for clarifying a lot of misconceptions and giving us the symptoms for the cold and the flu and other respiratory issues. And so it was a pleasure to have you on the show. And
Thank you so much.
and of course, as usual, I would like to thank you for joining me for this edition of Spotlight Houston. Don't forget, please drop us a comment. And if you have any story ideas, please let us know.
Thank you for joining us for this episode of Spotlight Houston, a production of Story Zone Media.